Go.
Hi, Jennifer Penrose here at Penrose Physical Therapy, and this is Michael, one of our technicians here. And today I wanted to show you a little bit about StimPod. So what this is doing, this is the ground electrode here. He's holding the probe at the ulnar nerve. You can see his hand kind of vibrating. And tell him what it feels like.
I would describe it a little bit like somebody rubber band snapping your nerves, so not necessarily super comfortable, but not painful. If you've ever had a TENS unit before, kind of cranked up to the point it forced a muscle contraction, it's just like that, but pulsed. So it's not just constantly causing everything to seize up, it's just kind of quickly on, quickly off.
Yeah, so it's a little uncomfortable, but manageable, right?
Absolutely.
Yeah. So we are having a workshop about neuropathy, nerve damage, nerve conditions, and Michael had an injury like 9 years ago, dislocating his shoulder, and had residual numbness, loss of strength, right? And then we got this device in and we started using it, and you treat the nerve for about 5 minutes, and in the first treatment, after 5 minutes, what did you notice?
Immediately was able to feel sensation better. So as Dr. Penrose said, I had kind of lost some of that feeling in my pinky and ring finger, and I didn't even realize it. I just had grown accustomed to it. But as soon as my first session, I was able to run my fingers over like the wall or my shirt and just feel texture better, like feel thread count better, you know? So pretty crazy. It's one of those things, again, you don't really know you're missing until you've done it. And you're like, wow, so that's how it should feel.
Yeah. And then also you notice more grip strength as we did a few more sessions.
Yes, so I'm a very active person. I like to do a lot of weightlifting, and for any of those pulling motions, like a deadlift, I've always noticed the bar was lower on my left side. Doing them after this, the bar has stayed relatively even because I'm able to grip harder with my left hand. So again, something I was not really even thinking about until I was like, oh yeah, that looks a little better.
Yeah. So the StimPod is really for people who have numbness, tingling, nerve pain, loss of strength. It's helping with all kinds of conditions, quite frankly. The longer you've had something, it may take longer. So our diabetic neuropathy patients, that's more like twice a week for 2 months is kind of the protocol for treating that with successful outcomes. You'll notice progress at each session, just like Michael did. And his was completely resolved in about, 4 to 5 sessions? Yeah, 5 minutes to that nerve is all we really were focusing on once we drilled in that it was really that side of his hand. So when we do the feet, we just put that electrode down at the toes for the nerves that end up going down to your legs. So I encourage you to come out to our workshop Thursday, January 23rd at 6 p.m. To learn about how we can help. It's non-invasive, non-addictive, no chemicals. There really is no contraindications. Unless you have a pacemaker, then we just need to figure out if your pacemaker manufacturer company if it will interact with that or if you're okay. So sometimes you can still use it with a pacemaker, but we need permission. Or any implanted electrical device that you might have, we would need to get that clearance. But otherwise, it's free to go. So thanks for listening.